I will be introducing our next speaker, Dr. Andrade, who is a family medicine physician at Kaiser Permanente, who also leads medical missions around the globe. Dr. Andrade, we welcome you and feel free to present whenever you're ready.
Hello. Can you hear me okay? Okay. And do I have the capability of displaying my PowerPoint?
Yes, you should have, yeah.
Do I have to hit anything? Do I hit share screen?
Yes, and then share your sound.
Okay, great. It's asking for a password. Let's see. PowerPoint? Hello?
It's working, we can see it.
Okay. Let me just set it to current slide. So let me ask the attendees on this call, from what high schools are people from?
So people on this attending the webinar are from high schools across San Diego. So we have a varied mix of high schoolers and middle schoolers too.
Okay, so I'm first just going to talk about my background. I kind of had an unconventional path to the medical field. I'm a full-time physician with Kaiser Permanente in the Department of Family Medicine. I'm also one of the associate program directors for our residency program. So when medical students graduate from medical school, if they want to go into family medicine, they could choose to come to our program, and we trained them for 3 years so they could be board certified in family medicine. So just a little bit about my background. I'm originally from Los Angeles. My parents immigrated here from Mexico. My dad was a waiter. My mother was a homemaker. We didn't have a lot of money. In fact, all 4 siblings were in one room at one time. Well, for most of the time, the siblings were there. I struggled through elementary school and high school. I lived in a pretty bad part of Los Angeles. There was a lot of gang activity in the 5th grade. Some of my friends were shot up by gang members. So I was more concerned about surviving my childhood, let alone my classes or even something as lofty as college. But as time went on, when I made it to high school, there wasn't as much to worry about in terms of violence and gangs and things like that. But it sort of left me ill prepared for college. So I struggled through high school. I went to a JC for a couple semesters and struggled there as well. And somehow I got into my head after speaking to one of my siblings, what can I study in college for the least amount of time and always have a job that pays well? And he suggested engineering. So little did I know engineering was actually really, really hard. So I struggled with my first couple of semesters of engineering classes. But eventually I turned my study habits around and things really improved. So instead of studying at home, I would study in the library. I started studying with study groups so people could sort of teach each other and learn from one another. I would treat every quiz like a midterm. I would treat every midterm like a final examination. So I just really focused on turning my learning study habits around, and it actually worked. I went on to Cal State Northridge and I graduated with a degree in engineering. And I really loved the classes. They were really challenging. I've always been driven by being challenged. But after working a year and a half as an engineer, I really found it boring because a lot of it was 2 weeks of designing something and then documenting things for 4 months or longer. So I didn't really find it as appealing. And I'm more of a people person, and at least in the engineering field that I was at the aerospace company, you could sort of isolate yourself in a little cubicle and not have interactions with people. So I asked myself, if I had it all over to do again, what would I do? And the same answer came to me over and over again, and that was medicine. I really love medical science, and I love the idea of applying science to help people. So I went back to Cal State Northridge and took the undergrad classes that I never had, like the organic chemistry, the biology, and studied hard and did well. The other thing is that I did is I volunteered at the UCLA emergency department and the child development department. So I got to speak to medical students and doctors and residents and really loved what they were doing and thought, why not? Why not go for it? So I eventually took the Mcat and did okay. Actually, I did a little bit better than okay. So I applied to medical school and luckily got in. So I was listening to, I think it was Dr. Pierce, the dentist before me, and a lot of what he said is similar to what you have to do to get into medical school. In fact, there's a lot of redundancy. So what I would suggest is if you're really interested in going into the medical field, you got to know what requirements you have to fulfill. So you need to speak to a counselor that knows what they're talking about. And there's a lot of different books that you could look at for preparing yourself for medical school. So similar to what he said about being screened, unless you have a certain GPA, unless you score a certain score on the Mcat exam, that's the medical college admissions test, a lot of medical schools will not even look at you. So I was fortunate, and even though my grade point average wasn't overall that high, I had an upward slope because my grades really improved dramatically after 3 semesters. So they look at this medical admission committees, they look at you as a whole, they look at your story. So even if you've struggled, it's not impossible to get into medical school. So number one, speak to a good counselor, know what you're dealing with. You got to do really well in undergrad. So the better you do in undergrad, the greater your grade point average, the better odds you are of getting into medical school. And then the Mcat examination is also equally as important. It can mean the difference between staying in California or doing residency in North Dakota. Not that North Dakota is bad, but a lot of people prefer to stay in California that are from California. So the Mcat examination tests you on chemistry, biology, physics, reading, and comprehension. In fact, I started preparing for it a year in advance because I wasn't the best test taker, and it's a lot of stress to decide whether or not you're going to get into medical school based on one exam. In fact, they offer a couple courses that are usually $1,000 to prepare you to do well on these examinations, and I would highly recommend them. They probably have them for dental school and law school. I know they do. So when I applied, I applied to 25 schools, and I was lucky enough to get into 15 of them. I attended medical school at UC San Diego. So when I applied, they only had 120 spots, and there were over 5,000 applicants. So I thought, geez, what are my odds of getting in? But luckily I got in and things worked out. So aside from your grade point average, doing well in the Mcat, you also want to do volunteerism, ideally something in the medical field. Research is also helpful. In terms of my day-to-day activity, I work for a large HMO, Kaiser Permanente. You probably heard about it. They have several clinics and several hospitals throughout San Diego and throughout Southern California and different states like Hawaii, Washington, Oregon, Colorado. So I'm in one of the teaching clinics. So my day is very different from most doctors. I see patients, I have my own patients. So 3.5 days per week, I see my own patients. I also round in the hospital with our resident team. So I and 2 residents and sometimes medical students work as a team together, and we'll see 12 patients. And during this period of the pandemic, we've been caring for COVID patients. So all those images that you see in the newspaper and the news of gowning up in those gowns, that's us, that's our medical team. Even though we're family medicine physicians, we're taking care of these critically ill patients. So aside from seeing patients in the clinic and taking care of patients that are really sick in the hospital, and when I say sick, it's like cancer, congestive heart failure, heart attacks, strokes, all sorts of medical conditions. I also get to do procedures in my practice. So I do surgical procedures. I do biopsies. So we remove lesions from the body that seem suspicious along the skin. We do gynecological procedures. We could put in birth control devices, toenail procedures, and then a large part of my time goes towards teaching our residents. So I'm training them to prepare for their practice, and we're also teaching medical students. Then when I'm not doing all of that, sometimes I volunteer either in communities within San Diego, like we're do high school physical examinations at some of the local high schools, or work with elementary schools, or volunteer in the food banks. So there's all sorts of great opportunities to volunteer in the community. Usually my day runs from 7:30 to 5 o'clock. And if I'm not rounding in the hospital, I have my weekends off. So that's typically kind of what my day looks like, and kind of my path into the medical field. So what I'm going to do is I'm going to show you some slides of some of the places we've been able to volunteer abroad, because that's really one of the most rewarding aspects of my job, is be able to provide medical care abroad. Whatever you decide that you do as a career, you got to find purpose. And even in medicine, you could do that for 10, 20, 30 years. And after a while, it might get boring because you've seen the same thing. But I found purpose by volunteering my service abroad and teaching the next a group of doctors that will replace me eventually. So I find my career really rewarding. I'm going to go ahead and just I have no disclaimers. So one of the first places we volunteered was in Ensenada, Mexico. This is with the UCSD undergrad Flying Samaritans. These are undergrads that are either interested in getting into medical school, nursing school, dental school, or pharmacy school. And they get the opportunity to work with doctors, my residents, local dentists, physical therapists. In the United States now, it's hard for you to work with doctors because there are now a lot of laws in place that don't allow you to do that. Undergrads aren't able to volunteer with US doctors in America that easily. So we would go one day per month, usually on a Saturday. We'd see roughly 30 to 50 patients. It's a combination of women, children, adults. The undergrads would serve as the back office. They would test people's blood and urine for diseases. And then our doctors would, along with medical students or undergrad students, would see these families. It's a really rewarding experience. Here's one of our residents with his newly adopted family in Mexico, just really lovely people, appreciative of anything that we could do. The other place that we've been to frequently is Jamaica. This is a family-friendly opportunity, not like some of the other places that potentially are a little dangerous. Some of the doctors bring their children, their spouses. We would volunteer in a local clinic 3 days out of the week, see roughly 50 to 60 patients. They would pay roughly $1, and they would get free medication from us and free medical care. What was nice about this experience is that when we weren't there during our 1 week, there would be another medical group the following month, so they got continuity of care. So here's a group of patients waiting to be seen. There's one of our doctors preparing our residents to see patients, describing how the clinic's going to run. And here's one of our residents doing a procedure on a patient. The patient came in with a soft tissue lesion on his head. He had been dealing with it for 20 years, and we told him that we could easily remove it. So a resident removed it, put some stitches, and he came back weeks later to have the stitches removed. So he was pretty happy with the results. It's not uncommon on our medical trips that we bring handheld ultrasound devices. So this patient came in with abdominal pain, and our resident is scanning his liver and his gallbladder looking for gallstones. So if we find something and they need a higher level of care, we have ties with the Jamaican Ministry of Health, and we could sort of get them plugged in to see specialists, but at least they could come to us and get nearly free care. A lot of great opportunities to see children during this trip. Here's one of our residents. We set up a table and you'd see the family and all the kids at the same time. So one of the places we volunteered in Jamaica was 3 Miles. This is an area where Bob Marley was born and raised. So this is an elementary school that was devoted to Bob Marley. So we would see roughly 180 patients in a 6-hour period. So we would use the classrooms for different purposes. Like this classroom was pharmacy. We would unload all our medications, and all of this was free to the patients. And patients would be triaged through one of the smaller kindergarten rooms. And as I mentioned, there were a lot of pediatric cases that we saw. And then the larger classroom, we'd set up a table, chairs, and one doctor would see the entire family. The other place I volunteered is a small rural clinic in Kenya, Africa. So this clinic is actually run by physician's assistants because they have so few doctors in Africa. There's usually one physician who's directing multiple little clinics or hospitals. So this is a 19-bed hospital run by these physician's assistants. And now they were very excited because they had just bought this ambulance, which actually made the difference between life and death for some of their patients. So here I am rounding with the Kenyan physician assistants, sharing information on how we do things in the United States and sharing best practices. A lot of my time went towards educating them. I'm wearing a mask and this other doctor's wearing a mask. We were actually caring for this patient with active tuberculosis. So I had to gently educate them on, you need to protect yourselves because that patient can infect you. The other thing is they had a patient with tuberculosis in the same room with someone who didn't have tuberculosis. Tuberculosis is extremely contagious. So a lot of education went behind. So this is that same patient with tuberculosis. He had a large fluid collection in his lung. That's the white portion that you see on the X-ray on the right-hand side. These are mosquito nets to protect against malaria. And again, education went into our discussions. They weren't using these mosquito nets even though they had them because a lot of patients would fear the mosquito nets. They thought it was a sign of death because they had heard stories how a loved one came to the hospital. They had this mosquito net or this shroud over their head and they didn't survive it. So they thought if you had this net over your head, you were gonna die. So again, I had to gently, kindly educate them on protecting themselves, protecting other patients, and best practices. Another fun place that we've been to several times is Thailand. Here I am with a couple of our residents and some volunteer elephants in the back. We volunteer with the San Diego School of Nursing through SDSU. So it's 35 nursing students and about anywhere from 3 to 5 residents. This was a great experience. We got to work with the Thai School of Medicine. They would help serve as interpreters. We saw a lot of pediatrics. Here we are doing some physicals on children who needed child examinations. We did health screens at some of the local temples for the monks. So great experience, learned a lot about the culture. It's really fascinating to see how people's beliefs are in different countries and working around cultural differences. For example, in Thai, you're not supposed to touch the head. That's very sacred and disrespectful if you do. And the feet are considered very dirty, so you don't touch someone's foot and then touch their chest. So a lot of learnings for us as well. Some of the places that we volunteered in Thailand, you could only reach through Jeep because this was deep in fields of bamboo and you would transverse little rivers to reach these little villages that actually didn't have any running water or electricity. We would do home visits. Here's one of our residents who was seeing a woman who had a stroke and the nursing students in the background taking her vitals. What was nice about these home visits is that we had a Thai nurse with us from the community, so we could make recommendations on changing their medication and following up with that patient. Here's a different patient that had a stroke, so we're meeting with the family, and we brought along a couple physical therapists to sort of describe exercises that they could do with their loved ones so they didn't wind up with bed sores. And again, here we are with our handheld ultrasounds screening for pathology. We would teach the nursing students how to use it, and they learned very quickly, and would teach the other nursing students. They actually got really, really good at it very quickly. It was impressive. So what you're seeing on that little monitor is actually someone's gallbladder. The other fun thing about the ultrasound is that it wasn't uncommon to come across pregnant women. So we could scan their belly and show them images of their baby for the first time, and they really loved that. Their faces would just really light up. And I said there's a lot of opportunities for peds. We are with one of our residents making friends. A lot more peds. Just some more images of the nursing students. And there was some downtime to do some fun stuff. There was a couple of days where we got to play with the elephants. Another country that we've been to a number of times is Peru. Here's our medical team from Peru with some of the local kids. Again, that's the beauty of family medicine, is that you could treat the entire community. We train you so you could treat adults, men and women, provide women's health care, contraception, obstetrical care, gynecological procedures, pediatrics. It's great to be a surgeon or a dermatologist or a dentist, but at least with family medicine, you can actually take care of the entire community. One of the things that really attracted me to family medicine is a statement that is pretty accurate. 90% of what a person goes to see a doctor can usually be handled by a family medicine physician. So you can't say that for all branches of medicine. So I really found it so helpful what I was trained to do when I went to volunteer in these countries. Here's one of our doctors with kids again. We would do home visits on a lot of these trips, be it in Thailand or Peru or Jamaica. So you would go to homes where people didn't have transportation, or they couldn't walk as easily, or they were afraid to go down to the site where we had clinics. So we would come to them if they needed to. Some of the patients that we saw hadn't seen a doctor for over 20 years. So we would actually sometimes do physical exam and procedures out in the open fields. There's one of our doctors injecting this woman with bad knee arthritis with a steroid to help with her pain. So we would also leave them with Tylenol or Motrin, and then our physical therapists would show them exercises for their knee, their back, their shoulder, their neck. So when the effects of the steroid injection or medicines ran out, they would have something that could help them with their chronic pain. So sometimes we do physicals, and these packs of llamas would just pass by us. One of our other doctors. Here's our guard dog watching over us. One of the most unique and fun trips I've ever been on was volunteering in Fiji. Here's my medical team. It's me and 3 residents. Fiji's this small cluster of islands above Australia. So we volunteered in a catamaran through this organization called Sea Mercy. So this is a catamaran that we stayed on, and that arrow's pointing to my room, which was really tiny. In fact, photograph was taken from the door, so there's not a lot of space. Here's the galley where we would have our meals, really tiny. Not a lot of room on the outside, but it's still a lot of fun. So we would travel, and eventually we would reach these really small islands like this one. And believe it or not, they're like people living out on these like tiny islands. So as we got closer to the islands, we would throw anchor, and we would get on the dinghy and have a wet landing, bring our medications, and see the local population. We are screening this patient for hypertension and diabetes. This is a different island in a different tent, but it's same sort of setup. make space, bring in patients, and provide medications when it was appropriate. And even children were being born in some of these really small islands. So as a woman's pregnancy would go along, they'd go to a larger hospital where they had an OBGYN doctor, and after delivery, the patient and their child would return to their home island, which doesn't have a lot of resources. One of the things that we found really helpful on most of our medical trips is bringing reading glasses. A lot of these patients were just really happy with the reading glasses that we left behind, because now they could do like fine work on detailed work on their jobs, or reading newspapers or articles that they couldn't read without glasses. During this trip, we also partnered up with a local dentist. We knew that we were going to meet up with that dentist, so we brought that dentist dental supplies. We would have a dental clinic in one of the islands, and one day we were just teaching the children hygiene in terms of flossing, brushing your teeth. One of our residents making friends. Afterwards, we would just drop anchor and jump in the water for fun. It was a really great experience. So that is just a sample of what you can do applying your medical degree abroad. And there are surgical teams as well. So plastic surgery teams go to Mexico, South America all the time to do cleft palate repairs. Some orthopedic doctors do procedures abroad as well. So whatever you decide to do in life, be it dentistry, medicine, and when I say medicine, I include doctors, nurses, physicians assistants, physical therapists. You can apply your skills to a lot of communities in great need. So are there any questions I can answer?
Yeah, so we actually have some questions in the chat, or the Q&A function. First question is from Sierra, who asked, what is your professional relationship with physician assistants and nurse practitioners like?
They essentially work independently for me. So I have a patient in the hospital, and the nurse practitioner for cardiology or diabetes will round on the same patient I'm taking care of, and they make some changes on their management, which I usually will agree with, and they help us out quite a bit. In some practices, you have a group of doctors and a nurse practitioner in that clinic, and they have their own set of patients. They come to us if they have a question on higher level care, or if they just want to pick our brain. So it's usually a very cordial, good relationship.
Our next question is, what does the day of a typical resident student look like?
So a resident is different from a student. A resident is a doctor. A medical student is something completely different. So you go to undergrad, then you go into medical school, and you're a medical student. When you graduate from medical school, you are now a doctor. To get board certified in a specific specialty, you're a resident, and that could vary anywhere from 3 years to 6 years. So for example, peds, family medicine are 3 years, neurosurgery 6 years. So the typical day varies. If they're in clinic, it's similar to my schedule. They're there from 8 to 5. If they're on a rotation where it's inpatient care, their hours are a lot longer and harder. So when they're on the medicine service with me, they will get there at 5 in the morning, rounding on the patients, and they'll present them to me. And then if they have a short day, they get to leave the hospital at 4 or 5 o'clock. But if they're admitting, meaning bringing in new patients that need to be cared for, they could be in the hospital until 8 or 9 o'clock. And usually they work one day over the weekend when they're on those inpatient services. And that applies to inpatient pediatric rotations for them as well. And then the OBGYN, if they have a pregnant patient, they'll get a warning that they have to go in and deliver someone. So it really varies, especially with the field that you go into.
Okay, we have another question, which is, how are you able to make these missions part of your job?
Oh, good point. Good question. So Usually it's in partnership with some organization. Like I didn't reinvent the wheel. I knew of some of these organizations and asked if I could join. And as I worked more with them, I started my own groups. So I would recruit from my workplace. I would ask different doctors and different nurses and medical students to join me on my trips. And then usually the cost isn't that much. Like the medical trip to Jamaica, everything included is roughly $1,400. And then for Thailand and Peru, that's more a little over 2,000. This isn't funded. It's all, you have to come up with your own funds. So if someone wants to do that, they have to raise their own funds. But I offer a service to our residency programs. So that's a big appeal for residency training, is the ability to do volunteer work abroad. So not only do I bring resident physicians from Kaiser San Diego, I recruit from Kaiser Los Angeles, Orange County, Woodland Hills, Fontana, Riverside. And it's a great experience because you get different people from different programs on the same trip. And my organization supports it. So when there wasn't a pandemic going on, I would do 3 large trips per year, and I would probably volunteer with the Flying Samaritans in Ensenada 4 or 5 times per year.
Okay. And then another question is, why did you choose family medicine over other specialties?
As I mentioned, you could do much more for the community as a family medicine doctor. If you've ever seen The Walking Dead, just think of what happened. All civilization collapsed. Having a dermatologist in your team wouldn't really help as much as having a doctor that could treat all adults, all children, all pregnant patients. If you don't have clinics, if you don't have hospitals, that's a great skill to have, is the ability to treat a community. So barring a zombie apocalypse, it's a good field to go into.
Okay, and then we have 3 more questions. One is, what was the most fascinating trip that you've been on to help others?
Yeah, I would say, my favorites were Fiji. Just living on a catamaran for 2 weeks is kind of a surreal experience, and seeing how people were living in these really remote, desolate islands that recently been struck by a cyclone. People were just so happy to see us and so appreciative. It was just really, really rewarding. So that really adds purpose to what I do.
Okay, and then another question that kind of connects to that is, how long would trips on a barge take?
I don't know about a barge, but I could tell you on the catamaran, it was essentially 2 weeks. So you got to reach Fiji in the first place, which you lose a day in traveling. So you travel for technically 2 days. You meet at some location and you rest up for a day or 2, and then you go on your medical trip for 2 weeks. And then afterwards, most people plan some downtime to recover from all that intense work. So you're there for another 2 days.
Okay, and then last question for today is, what do you recommend a high school student do if they want to become a physician?
Oh, so I would look up a book that is called, I don't recall the exact title, but there's a number of books that they're titled Getting into Medical School, or admission requirements for medical school. That will sort of paint the picture of what classes you should take and prepare for. And I'll give you statistics in terms of the number of medical schools you could apply to and what they're looking for, and how many people they accept from out of state versus in state. And then you want to do as well as possible in the undergrad. So maybe that means only taking 3 classes the first time and seeing how you do. And if you're doing really well and you want to take more classes, great. But what you don't want to do is fail classes or do poorly. And then the other thing, as I mentioned, is preparing for the Mcat examination. There are a number of great courses that you could take. Like one of them is Princeton or you have access to a lot of test questions that are very similar to the MCAT. So you get very good at taking and answering questions in preparation for the MCAT examination. And then do volunteer work. They don't want robots that are just capable of getting A's in biology and chemistry. They want human beings. They want someone that is diverse. So when I look at my medical school class from UC San Diego, it wasn't just pure people who majored in biology and chemistry. They had me, who was an engineer. They had a couple of us, and then they had art majors, history majors. So it runs the gamut. So try to be as diverse as possible, because once you get past the screening of, do you meet the grade point average, do you meet the MCAT score that they want, when you have 10 people that are all straight A's, they're going to want the person that really stands out, that is different, that has done unique volunteer work, that has traveled, or that has some unique skill.
Okay, thank you so much, Dr. Andrade. It was inspiring to hear you talk about how you've been able to provide for people all over the world. It was cool to see all the places you've been to. So thank you once again for being
Sure,
here.
my pleasure. Good luck, everyone.
Okay, and that is a wrap on our STEM Day. Thank you everyone for coming. We greatly appreciate your support and attending, and also big thanks once again to our wonderful speakers for sharing your educational stories and advice. We hope you're able to take away at least something from our conference that will be useful to your futures or future careers. And to everyone who stayed since the beginning, thank you for spending your Saturdays with us. Next Saturday's category is business, and we will begin at the same time. If you have extra time today, please make sure to fill out the feedback form that we will put in the chat so we can hear your thoughts about your experience attending our webinar. And with that being said, thank you so much for attending Spark Conference 2021, and have a great rest of your day.